Good afternoon, Pride families. With the uptick in COVID cases in our Pride community, I thought it would be prudent to speak to the current climate of the program. After responding to many of the same questions, it seems it would be beneficial to address these questions with all. Have you considered closing for 2 weeks and going virtual? Yes, we have. However, to achieve a positive outcome in preventing the spread of COVID-19 in our community, all participants and their family members would need to commit to a 2-week quarantine period, and we know that is unattainable. At this stage in the pandemic, and after all the advocacy efforts to reopen day programs, Pride has decided to remain open for in-person services. As always, this is a fluid situation, and if anything should change, you will be notified. Due to the hiring crisis and staff limitations, in-person and virtual programming cannot run simultaneously. How are you advertising for hiring? Our job postings are on Indeed, Handshake, LinkedIn, our ECLC website, our ECLC social media pages. Our job postings are posted at local libraries, grocery stores, and community bulletin boards. We are hosting virtual job fairs monthly, and we are offering referral bonuses to current staff. Our loved ones are immunocompromised. What is the program doing to keep our participants safe? Pride is committed to layered prevention strategies such as requiring masks, currently contact tracing, following rigorous cleaning and disinfection procedures, demonstrating, practicing, and adhering to frequent hand washing, encouraging vaccination, improving ventilation, prioritizing outdoor activities, and physically distancing when possible. If someone in my household is at high risk for COVID-19, is it safe for my loved one to attend program? This is really a conversation that you want to have with your primary care physician. We recommend following the same layered prevention strategies in your home if your loved one or you are at high risk for COVID-19. Please know that Pride understands that we will continue to have fluctuating attendance, and we respect your decision to keep your loved one home if that is what's best for you and your family. Please share your plan with Pride regarding your loved one's attendance. What is community transmission, and why are we following the COVID-19 community level report? Community transmission means that the virus that causes COVID-19 is spreading and affecting people in your local area. DDD requires day programs to closely monitor the COVID-19 community level report and adhere to specific guidelines based on the community's transmission level. Those were my frequently asked questions, but in addition to those, we have been receiving phone calls and emails expressing the frustration and exhaustion regarding the close contact testing requirements. We heard your concerns, and after persistent attempts to gain clarity on rather vague guidelines, we received authorization to accept home testing for close contact individuals. Nurse Megan, I'm going to turn it over to you so that you can provide details about Pride's requirements associated with home testing.
Thank you, Christina. First and foremost, I would like to thank everybody and flexibility during this difficult time. We do realize the testing and everything that goes into making sure that Pride can remain open is difficult, and we just so appreciate all of the help with that in order to keep everybody safe and healthy. Regarding the testing, so we are going to be accepting at-home COVID test results for asymptomatic close contacts. So if your loved one is a close contact of a COVID positive individual and they are up to date on their vaccines and boosters, we are going to accept an at-home COVID test result. If your loved one is symptomatic, first and foremost, we ask that you please keep them home and get them tested with a PCR COVID test at a medical site. Please let Pride know immediately that they're not feeling well, and please forward those results promptly. Regarding the testing, if there's issues getting testing, securing it, please let Pride know. But first and foremost, please contact your loved one's insurance company. With the testing, every test is different. You want to make sure your test is FDA approved. And as far as that goes, we also want to make sure we're reading the directions for the test to ensure that we're getting accurate results. Proper hand hygiene before administering the test. The swab should not touch anything but our nasal passages. And we want to do on both nasal passages, 15 seconds in the first one, 15 seconds in the second one. We want to make sure that we're reading the results in the time that the test is specifying. So if the test asks you to read the results in 15 minutes, please set a timer and read them in 15 minutes. If you read the test result too soon or too late, you will have an invalid result. When you are sending results to us, please send the results to myself along with your client's respective management team via email. We'll need a picture of the test, a picture of the expiration date. As far as that, we will also need something signed called an affidavit, basically attesting to the fact that your loved one was tested and the test was performed correctly on the date that we're requesting to the best of your knowledge. Those will be going out shortly, as well as an updated PRIDE procedure plan. If there are any questions or concerns regarding COVID testing, please let us know. And again, we just want to thank everybody for their continued patience and understanding. And I'm going to toss it back over to Christina for some closing remarks.
Thank you, Megan. I know that this has been really challenging. It's been really challenging for all of us, and we are with you on this. We know how frustrating this is. We know we're all kind of over COVID, but it's still with us. And because it's still with us, we want there to be choice to come to program and be in person. We feel like that is very important for our participants. They need schedule, routine, and a community. They need to be with their friends. They need to see people in person. And services here are very hands-on. We're doing cooking and baking and sport activities. Those things can't be done virtually. And so we just want everyone to know that we respect your decisions. Again, I said it earlier, but I'd like to say it again. We understand that attendance is going to vary for the next couple of weeks and possibly in the future. We want you to make safe decisions for you and your family, but we also want you to know that we're here for you and we're here for programming. I really appreciate all of you. I appreciate your cooperation. I appreciate your kind notes of support. And we just want to thank you from the bottom of our hearts for all that you've done during this time. And we hope that you have a wonderful, safe Memorial Day weekend. And we will see you on Tuesday. Take care.
Thank you.